Good afternoon, everyone. It's a privilege for me and honor to introduce the next speaker. Dr. CHINABABU S is a robotic surgical oncologist with over 23 years of experience. He is currently the clinical director of surgical oncology at the Yashoda Cancer Institute, located within Yashoda Hospitals in High-Tech City. He is also founder and CEO of Grace Cancer Foundation, an organization that focuses on cancer education, early detection, treatment, and research. Dr. CHINABABU S graduated from JJM Medical College, Davangere, and completed his post-graduation in general surgery at Government Medical College, Surat, where he was a gold medalist and university topper. He received his MCH in surgical oncology from the Gujarat Cancer Research Institute, where he ranked second nationally. He has also undergone extensive international training, including fellowships and specialized training in robotic and advanced surgeries at institutions in Paris, Seoul, New York, Tokyo, and Los Angeles. Dr. Sunkavalli is known for a pioneering low-cost cancer screening in India through mobile cancer screening campaigns. He holds Guinness World Records for the largest oral and breast cancer screenings and a Limca Book of Records for cervical cancer screening. His foundation, Grace Cancer Foundation, has reportedly impacted millions of lives across multiple continents and countries. He has also been the recipient of numerous awards, including the Best Doctor Award from the King Foundation in August 2022. He has authored a book titled Live for a Legacy and is a prolific contributor to the peer-reviewed journals. He is an expert in a wide range of cancer surgeries, including those for the uterus, cervix, ovary, breast, colon, stomach, and lungs. Married to Dr. Pramila Rani, blessed with 2 children, Prisha and Ashish. I invited Dr. Sunkavalli Garu.
Greetings to you all in the matchless name of our Lord and Savior Jesus Christ. I am humbled and thank you so much for the kind introduction. I think it was too much of an introduction, I felt so. But grateful to God for what He is doing in and through us. And I am more humbled to speak after somebody who spoke so well. So, great to see Dr. Spurgeon here. And of course, I'm given a topic now because we have heard just now about man, movement, machine, and monument. And now actually we're talking something about the machines now. So it's very important for us to really look at the right approach for us. How can we really bring in or integrate technology and integrate the buzzword that everybody today has is about artificial intelligence and digital platforms, even as we try to extend our missional footprint. So I'm thankful to God and the organizers of this EMFI National Conference for this privilege to speak an important topic, because to be relevant, we need to change our methods. We don't have to use the same methods that we used 50 years back, 60 years back to be relevant even in the mission field. So I represent Christ, because at the end of the day, that's what we just now heard. It's all about being relevant in how we present Christ in and through where the Lord has kept us for extending His kingdom. So my talk will be more of a professional talk in terms of the relevance of how technology can be adopted in the mission field. When I say mission field, it fits into the criteria that we just now heard, but it can be anywhere in the country and anywhere. It need not be a rural mission field. So what I'm going to now look at is the mandate that we have, with respect to what the call that the Lord has given to us, right? Just now we saw this slide from Luke 4, 18 and 19. We need to bring the good news. We need to look at the healing. We need to look at the freedom or liberty for those who are imprisoned. So now for this mandate to achieve in the current scenario, how can you and I bridge the gap that we have? Millions remain medically unserved, spiritually unreached. So traditional models no longer can reach the scale. Technology can help to bridge this gap. That's the point that we need to understand this morning. When I was born again, like, some of you are like students here, we are very pious to take a megaphone and go to the streets and preach the gospel. That was a wonderful method those times. Today, it may not be the case, but we have so many other avenues with technology to take the message or the good news across to the communities. So, the digital revolution is the new frontier that we are looking at, and the rapid digital transformation. We have seen how India has adopted the mobile transformation, unlike in the West. Within the last 20 years, you see rapid mobile or the digitization, the data and the connectivity. Today the number of cell phones are much more than the population of this country. So given that, I think there is a divine opportunity for us. Some tools that we have, we need to use them responsibly for greater reach. So digital platform could be our new mission field. It could be, people might think, how could this be? But this is how the world is wired today. So, just to give a small example, right, how digital platform can help us for reach and connectivity. COVID has given us an amazing opportunity of how telemedicine could be accepted. Before COVID, we were not really accepting telemedicine or teleconsultation. E-learning, discipleship, right, scalable training for health workers and believers is possible. You can look at digital giving, transparent, accountable, resource mobilization can be done with the help of technology. So you can actually turn a hospital room into a national classroom. So dear brothers and sisters, the power of AI is something that we are looking at. I will quickly talk about how AI is transforming the way we do surgeries as well. And precision and insight is something that we are getting with the help of AI. So predictive analytics, right? We can map high-risk health areas. AI diagnostics helps us to, specialist level diagnostics are within the reach through mobile apps for a common man. Real-time translation. Look, you have a mission hospital in a community setting in a rural area wherein you can actually communicate with your patient in their own language. Today, we write a case sheet in English, doesn't matter, that doesn't mean anything to the patient who cannot read or understand. So in that sense, language barriers will be broken big time in the very near future. People say today it is not cutting edge technology. People say it is bleeding edge technology. That's how the technology is fast forward, is progressing. In and through all this, again, one thing that I want to remind you, even as we adopt to technology, the centrality is Jesus Christ himself. He should be glorified in and through whatever we do. But these tools must be used efficiently for greater reach. So from mass communication to precision mission, we have AI coming up in a big way. So even as we look at an example of a rural EMFI clinic can use AI to screen diabetic retinopathy. Just with your mobile phone, you're able to take an image and you're able to send it across to specialists who are not available at your place. Thereby you do an early detection, timely treatment, and sight is preserved. So the impact can be scaled with technology. So basically AI is democratizing specialist care for the underserved communities. So another example, automation is something that we're all talking about. Now I think this automation is different from what Dr. Spurgeon spoke about machine. This is the machine automation, the mundane task. Most of the mission doctors are overwhelmed with so much of administrative tasks. So all that can be automated in terms of the repeated mundane task. That can be definitely done by technology. So doctors actually are reclaiming the time for their patient care and ministry. I was giving a talk at IIM Bangalore last month. One of the profound questions the leaders in AI were asking was, if AI is helping you to save time, what will you do with the saved time? I think this is one question that each one of us must answer. If you are able to save time with technology, what would you do with the time that you save? I think if you can answer that question, our impact can be scaled multifold. So actually you're freeing the healer to heal than do any other mundane task which may not directly have exponential impact. So the promise of AI, I'm quickly coming to the role of AI in general in medicine and then how in surgical space it's evolving. If you look at the excitement, I organized a conference this year for AI in healthcare. we had 1,200 registrations because the doctors are really interested. They are really scared to some extent whether they might lose their jobs. 85% of the healthcare leaders are exploring AI today. It is more real than an imagination. So the machines, what is AI? Machines imitate human thinking. I think that's what the whole, the idea of artificial intelligence is. Basically, it learns from data to improve over time, finds patterns, it analyzes information very quickly. The other day I was giving a task to Google Research, tool, just to kind of make a serious document and a research protocol for the impact of cancer awareness and the effort that we are putting through the Breast Cancer Foundation. It gave me 200-page document of how we can conduct a research and how the outcomes can be analyzed. So that's how, because the processing is so much possible with the machines than what we can do humanly. So applications in healthcare in terms of diagnosis, prediction, patient support we can look at. So now what is it that AI is doing today? It improves the patient care and outcomes. If you have seen the publications, especially with respect to the radiology and pathology, I think they're the two departments where there's a big application of AI. 58% faster, 54% more accurate diagnosis can be done with the technology. So better outcomes, about 55% from earlier intervention and precision. So accurate treatment shows dignity and respect in Christian care. So we cannot say that this is not applicable to us as children of God. So how to make AI work? I think one of the simplest things is to make it incrementalism. The implementation is a challenge, especially in a world wherein we don't have electronic health records today, even in the best of the best hospital settings today. How do we really implement AI for patient good? I think that's a challenge, but that can be solved with AI. One of the vice president of Google who visited us, he was telling that the application of EMRs with AI is much more simpler than without, because any voice to text and all kind of, you don't have to do so much of paperwork what you used to do for a routine EMR or electronic health records. So the value lies with AI in solving the actual problems, not showcasing some technology for the sake of novelty or for the sake of appreciation. Systems thinking will definitely help us to make AI work. So now, what is the impact of AI in the modern medicine? Is it real? Is it hype? Is AI going to be your foe or your friend? I think there are all of them could be true. One important thing is diagnostics are enhanced. As I mentioned before, early detection is possible. More accurate diagnosis can be done. Your mammography, your X-rays, your CT scans, your MRIs, all of them can be better interpreted than what a human eye can see. I think that's where there is a value. So personalized treatment plans, especially for robotic surgery for that matter, even for that matter, radiotherapy, which is, AI-powered treatment plans can be done. Predictive analytics, I mentioned already, also helps in clinical decision support. Drug discovery is a big area wherein with AI, the discovery of a drug from, bench to the bedside, it takes usually 12 to 15 years. That can be reduced to 7 to 8 years. That is the potential that we have with technology now. So which all areas it is already percolating? All aspects of healthcare. So we need to be aware of it and we need to excel in adopting technology responsibly. So preventive and population health, diagnostics like radiology and pathology and genomics, these three areas are already in a big time. Adoption has taken place. Of course, we also use in therapeutics, including something called IBM Watson Oncology. And if you look at the number of FDA-approved products for AI today, more than 700 plus FDA-approved products are available in the market. So it is real than what we think or what we assume it to be. So hundreds of companies are developing the products. Real-world examples, for example, Google DeepMind, helps in early detection of breast cancer through mammographies. Now the AI doc, emergency triaging can happen better. Flagging the hemorrhage in the brain or embolism, it can help you to give you some kind of a alert. And of course, Cure AI helps in TB and lung cancer screening. So a lot of products are available today. I don't want to go into all of them detailedly, but I just want to encourage you that technology needs to be adopted responsibly. So in medical oncology as well, again, we have a genomic profiling, risk prediction is possible, clinical trial matching is possible with AI, and of course the treatment decision support also is possible with technology. So real world tools, even for radiation oncology for that matter, helps in better planning and better delivery of the radiation dose to the patient precisely. So in medical imaging, across all spectrums, this is an example of how in oncology alone, right from the assessment of the tumor burden to radiomics to, assessing the brain morphometry to lesion detection, including guidance during the surgery for a brain surgery, for a brain tumor surgery, it helps, in different streams. So a field which is already transformed by AI is radiology. So they do better diagnosis than radiologists, faster analysis in terms of the X-rays or CTs or MRIs. Human error and burnout is reduced, and rare pathologies are flagged off. So that's what we look at. So as a friend, AI can support us, in terms of the automated image interpretation, triage systems, reduce human error, or real-time reporting. For example, I do a cancer screening, in a community setting, in a rural village, and they don't have to wait for 2 weeks or 1 week to get the mammography reporting or the pap smears reporting done. It can be done real-time with technology. So that's where there is a real usage of this technology that we have today. So as a friend, the benefits of AI integration is to improve the accuracy, improve the efficiency, early detection and prevention, better experience of the patient because their wait times are reduced, and of course it is cost effective in the long run. So the dangers of that lurk with AI could be there is a bias in the algorithms. Most of the algorithms are built with Western data, so the interpretation, the misdiagnosis in some people can happen. There is something called the black box problem because we do not know how these algorithms, how these machines are learning and how they're interpreting is beyond our comprehension. So there is no transparency in decision making. Job displacement for some radiologists and technicians is real. Of course, over-reliance on this technology can erode the human diagnostic skill, which already is eroded much, and which will erode further with the advent of AI. So the unspoken and shocking truths of AI, also data harvesting without consent, right? Ghost AI authorships, publications, all that can happens, and surveillance through military. And most of the times, one of the shocking truth of AI is AI systems actually they hallucinate. They make a very confident but false diagnosis actually. So that is a real problem which is being solved. So the challenges of AI could be in terms of data privacy, bias and fairness, regulatory compliance, the trust by the clinicians and integration into the regular healthcare infrastructure. We still have a long way to go, but we need to be prepared to integrate even as the technology will stay definitely. So because when I started robotic surgery about 13-14 years back, people thought that it's a fancy thing, it is only for the very affordable elite, but it has become now, even in the government hospitals today, you have robotic systems. The cost of a robot has come down from 25 crores to 5 crores, which will, in the next 2 to 3 years, it will further come down. So all technology initially is expensive to begin with, but later cost will definitely come down. So the real world consequences for a common man, especially with respect to AI development thus far, it can be, integrated partner into the routine systems, right from the decision making to diagnostic support, into robotic surgery, access globally for healthcare, especially for the remote areas, personalized medicine, and of course, big, role in predicting health issues even before they occur by means of predictive analytics so that you can proactively manage them in preventive healthcare. So the future of radiology, I would say, is a coexistence, not replacement, because AI excels in detection, humans excel in judgment. So ultimately, the judgment, the human role cannot be totally taken away. So radiologists as AI supervisors, not an obsolete professionals. So new roles will emerge even as we see in the next 5 to 10 years, especially for the youngsters. You will have something called AI ethicist, or AI medical data curator, or AI QA, quality checks, or some of these newer roles will definitely emerge even as the technology, advances further. So real world, do we use these models already? Yes, already we are using some of them even in the place where I'm practicing. The moment CT scan is done, the AI model will actually report, and it will give an alert to the patient and to the doctor if there is any suspicious nodule in the lung. And this is being already real time being used. So definitely it is being used, and in robotic surgery, in drug development and prediction of the disease, this is being used so far. So definitely precision medicine is something that we are looking at, and AI is actually changing the very future of precision medicine, right from identifying the causal genes to identifying the phenotype or the genetic heterogeneity to the different roles of physicians, early detection to monitoring real time, elderly care, you can do a remote monitoring from home, to identifying the potential drug targets. It is changing the future. And I'll quickly take you through how AI is transforming the way we do surgery, because today we are looking at from a traditional surgery which is based on your skill. Most of the time surgery we call it as an art actually. So from skill and experience and intuition, now we are shifting towards a surgery which is data driven, which is based on the automation, which is based on the intelligence. So I call this as a smart scalpel. The routine traditional scalpel has now become a smart scalpel. So why is smart scalpel needed today? Okay, if you look at the need, why does it matter now? If you look at the demands are rising, workforce shortages, surgical errors, and patients' expectation also, especially with enhanced precision and minimally invasive approaches, that's where there is a need. And for all of us, we know what is surgery. Surgery is nothing but it's a controlled injury, right? So the controlled injury depends on, the quality of a surgery depends on the bleeding, infection, scarring, bowel dysfunction, wound complications, and the pain. Now, from a patient's point of view, what is the value of a particular procedure, whether it's an open surgery or a laparoscopic surgery or a robotic surgery? The patient's value for any procedure is directly proportional to efficacy. Nobody wants to compromise with efficacy. Oncological outcomes must be good if I do robotic surgery compared to open surgery. But the beauty of this whole thing is that the patient's value is inversely proportional to invasiveness square. That means to say, less the invasiveness, more the patient value. So at the end of the day, in our healthcare, patient is the center to get the maximum value that we need to give to them in terms of the outcomes. So the smart scalpel evolution, if you see, from open surgery, we moved to manual surgery, which is from a very telescopic surgery to laparoscopic to advanced laparoscopic to robotic, and now we are looking at AI-assisted surgery. So the future of surgery is going to be intelligent, it's going to be intuitive, it's going to be very, very precise. So robotic surgery, if you see, where are we today? It's a 3D vision. We have a fine range of motion, even in the difficult pelvic areas where your hands cannot reach. You have a fine range of motion. Ergonomics are much better. You sit in the comfort of a console and the robo with motion scaling possible and filtration of tremors possible. And you can do even telesurgery, which is going to be a reality very sooner than later. So what is the real difference of robotic then? Is it a hype? If you see the camera and the operative field, right, this is on the left side, you see the laparoscopic, you keep shouting on your assistant to focus on the camera, to focus on the organ of interest, whereas in robotic, actually the assistant is dozing off. So that is the kind of difference. In real world, it is there. The camera, the operative field, everything is in surgeon's console. Even for that matter, right, 3D image, the kind of, you can see the autonomic nerves much, much better with 10 times magnification 3D view compared to, you can actually see what has to be preserved than what has to be removed, so that the outcomes to your patients are much more precise and good. So surgical intelligence is a new word that's coming up for those of you who want to pursue or in surgical field. So integration of AI, robotics, data, and real-time analytics, is what is called as surgical intelligence. It actually enhances your decision making real time and also, gives you a precision surgery. So basically, surgery is now becoming from art to an augmented science. So we are moving from skill-based to intelligence-based or intelligence-enhanced surgery. So you might ask, what is it that technology can do in surgical space, preoperatively, in diagnosis, risk assessment, planning for a particular surgery, planning, you can do a rehearsal of the procedure preoperatively, surgical simulator and training. During the surgery, real-time navigation, it can guide you, it can tell you where a vital structure is there. For a gynecologist, the mother-in-law is a ureter. right? So it will tell you where exactly the theater, how far are you injuring it, tissue identification, post-operatively, right? Tracking of the recovery, complication prediction, your outcomes to the patient, all this can be analyzed much, much better. So the augmented reality, virtual reality with AI-driven feedback helps you to learn a procedure much, much better. So immersive simulators are available today. High quality education can be given with this technology. Now we are also looking at a preoperative smart OT, which is going to be, coming very soon, wherein the theater is sterilized, the robot is kept docked, and everything is kept ready. Even before you get into the theater, everything is kind of, set in motion for you. So the fusion of AI and robotics during the surgery is what we see. For example, this is a case of lung nodule for which a robotic surgery is planned and the robot is docked. And then on table, real time, there is a navigation to see a smallest nodule. And once you see that nodule, you remove that nodule, do a wedge resection, send for frozen. On the same sitting, you're able to complete the procedure so that you don't bring the patient back second time. So how does it help during the surgery? Accuracy is there, real-time decision support is there, and of course trauma is less because it's minimally invasive. So for example, I'll just give you a small example of how these technologies helped us. There's something called as fluorescing imaging, what we call as the sentinel node biopsy that we do. So you give an indocyanine green and it fluoresces the signal, and with the surgeon console, you can see whether the vascularity is there or not, because it's, it is seen in the blood vessels. For example, if I'm doing endometrial cancer surgery, right? So even as we see here, the indocyanine green is given and the fluorescence is seen. The node which picks up this indocyanine green is taken out, is dissected, and that node is actually sent for a frozen section. If that node is positive for malignancy, then a systematic lymph node dissection is recommended. Otherwise, unnecessary lymph node dissection can be avoided for the patient. So this is the sentinel node, the node which picked up the indocyanine green, and that's how this, with robotic integration, it's helping us. And this node is removed and sent across for frozen. And once it comes negative, you don't have to do the lymph node dissection. So similarly, the Tile Pro technology helps in real-time navigation where the blood vessels are there, where anatomy is real-time integrated so that the surgeon can do a better surgery. So intraop navigation, I'll quickly skip for want of time. Today, robotic technology doesn't have a feedback, or the haptic feedback is the one negative aspect of robotics. Even that is now overcome with the AI technology, wherein force feedback, 43% better appreciation of how hard you are holding a tissue can be assessed with the help of technology, so that you know how you are handling the tissue with gentleness. Of course, I'll skip this. Smart stapling today, you know which stapler to apply for which tissue. Now the technology is able to tell you, you will not do any mistake on table by firing a wrong, color of reload, when you are doing anastomosis or when you are dissecting any particular vessel. So operation theater black box is what we are looking at. Just like in aviation industry, you comprehensively the data, what happens in a OT is captured so that your outcomes can be improved in the days, for you to analyze for your own good improvement. There is something called as kinematic data, the video data. All that we do not really actually do a quality check. We do not analyze the system events. So that's what we are looking at, the objective performance indicators. In the days ahead, for all the surgeons, for all the clinicians, you will have a metrics or analysis. There will be a particular objective way of assessing how good your surgery has been. I might come out and say, this surgery was very difficult to me, but was it really difficult? Was it because you underperformed? So all that can be analyzed with the data that we have, with the movement of your instruments, with your camera distance, with the articulation, with the pitch, with the workspace. All that can be analyzed and scoring can be given. So this is what we are looking at. So objective performance indicators can actually assess surgeon learning, and evaluation of every step can be done. So for experienced surgeon, how he does, and a new surgeon, how he does, both are compared, and then an index is given whether you have done a good job or not. So Video analysis again can be done with AI. Today, you know, the YouTube used to take a lot of time for giving a clearance for a particular content was good or not up to 48 hours. Now with AI, they're able to do within few minutes. So that's how the intelligent integration for safety of the patient, guidance intraoperatively, precision learning and knowledge, I think it is helping us in a big way. And it is one of the most preferred methods of surgery. Human AI synergy in the OT helps. It is not autonomous yet. There is no autonomous robotic surgery still. It is still, robot-assisted surgery. So the challenges, definitely high cost. As I mentioned before, we have at least 5 robotic systems now. The cost is come down by 5 times, which still is very high. But again, in the next 3 to 5 years, we will see much more, economical version of robots coming even for the periphery. So the AI and robotics are going to be transformative allies. Smart scalpel is redefining the surgical frontiers. The future surgery is going to be intelligent, ethical, and empathetic. So AI as a support system, augments human expertise, does not replace it. It increases the reach of the healthcare to remote regions, reducing the cost and improving the outcomes. So AI plus human could be the best of both worlds. You must have heard recently in newspapers that the telesurgery has become much more common these days. The first transatlantic telesurgery was done 25 years back. So much more now, telesurgery is going to be reality. Operation Lindbergh was a pretty popular one, and in fact, this is going to become a reality very sooner than later. As I asked you one important question, with technology, you will save time. So if you save time to the tune of 70% of people believe that, then you redirect your time to personal, compassionate patient care. In mission hospitals, more so, more time to pray, with listen to and comfort the patients. So increased efficiency is possible, reducing the burnout for yourself, addressing the staff shortage is possible, and you have better access to the patient records, and efficient management of the patient records is possible. You can communicate with your patient much better, and of course misinformation also can be countered with the technology. Quality time spent with patients is important even as we are in the mission field. So a word of caution, again, I mentioned about the data privacy, and of course that we need to keep in mind, but the future is going to be hybrid with the tech-enabled incarnation, wherein the technology as a lever, not as a replacement for love. That's what I think. The human delivers a Christ-like compassion, whereas AI is able to do the routine, mundane, repetitive task. So the call to action for each one of us could be 3 ways. I will look at 3 E's. Engage, explore technology in your ministry, in your specialty, learn and excel in the technology that is available today. Equip, train local partners in digital literacy, and ethicize, advocate for AI that serves the poor. So we need to engage, equip, and ethicize. And I want to close with this: the digital platforms increase the reach, AI gives precision, automation gives efficiency. Together, they expand our missional scale to fulfill the Great Commission. So, to conclude, AI is a tool to serve, not replace the healer's touch. By easing the burdens, AI frees clinicians to show the love of Christ. Mission hospitals can blend technology with faith-driven care, shining as lights of hope. Thank you so much for your patient hearing.